Does it feel like every chair you sit on is made of barbed wires? Does your car seat feel like a throne made of cactus? Have you been standing in all your office meetings lately? Perhaps it is not the chair. Perhaps it is your, But it is nothing to be ashamed of. Estimates suggest that at least one member in every family suffers or will suffer from hemorrhoids or piles at some point in time. Let's explore the condition for our better understanding. We all have blood vessels in the anal canal. When these blood vessels get inflamed and swollen due to any reason, we call them hemorrhoids. Occasionally, they form lumps which are felt as soft swellings at the anal opening. Hemorrhoids can form due to various reasons, one of the most common being constipation. If you are suffering from constipation, you are more likely to suffer from hemorrhoids. This is because a constipated person tends to exert more pressure to have a bowel movement, thus putting stress on the delicate veins of the anal canal, causing their walls to weaken. Eventually, the vessel wall loses its elasticity and becomes dilated, swollen, and tortuous. Other causes include sitting on toilets for too long, pregnancy, family history, obesity, and lifting heavy weights incorrectly. Symptoms: if you are experiencing painless bleeding while passing stools, itching around the anus, feeling a lump outside the anus, or extreme pain while sitting, it is time to consult a doctor. At Healing Hands Clinic, we have highly qualified proctologists coupled with state-of-the-art facilities to provide comprehensive treatment of curing piles. We follow a scientific, grade-wise treatment approach as conceived by our founder, Dr. Ashwin Porwal. In the earlier stage, or what we call grade 1, the patient can experience occasional painless bleeding and itching around the anus, but no mass is felt at the anal opening. Grade 1 hemorrhoids that do not resolve by themselves are treated by an ingenious technique called MCDPA, which was developed by Dr. Ashwin Porwal himself. It is a holistic approach intended to halt and reverse the early stage of disease without any surgical intervention. It incorporates herbal medicines, diet counseling, and pelvic floor physiotherapy. In grade 2, the hemorrhoids protrude from the anal opening during bowel movements but retract back on their own when the bowel movement is complete. The early stages of grade 2 are treated with MCDPA. Advanced grade 2 are treated with Laser Hemorrhoidoplasty. In grade 3, the hemorrhoidal mass comes out during a bowel movement and needs to be manually pushed back by the patient. Grade 3 is also treated with Laser Hemorrhoidoplasty. How does laser work in hemorrhoids? Through the natural anal opening, laser energy is applied using a special radially emitting fiber. The controlled emission of laser energy leads to vaporization, causing the hemorrhoidal mass to shrink. Advantages of laser: no cuts, no stitches, quick healing, minimal pain, and patient can resume work by third day. In grade 4 hemorrhoids, the mass remains outside the body and cannot be pushed back. In this last stage, treatment is done using a cutting-edge procedure called the MIPH, also known as stapler hemorrhoidopexy. The procedure takes around 25 to 30 minutes. We have successfully treated more than 20,000 patients suffering from piles. Healing Hands Clinic is a certified center of excellence in proctology by world-renowned colorectal surgeon Dr. Antonio Longo, the inventor of stapler surgery for piles. For a consultation, find your nearest Healing Hands Clinic now.